Hello, everyone. Welcome back to my YouTube channel. My name is Dr. Hamid. Today, I'm starting a new series, which is pharmacology, very high yield for step one and step two preparation, as well as for step three. In some of my lectures, I have discussed systemic fungal infections. So, I thought that I should start with antifungal therapy first because we have talked about systemic fungal infections already, and I am using first aid. This diagram, which you are seeing on your screens, is very high yield. I will go from inward to outward of this diagram, and we will discuss each class of antifungal therapy in detail. First, I will start with Terbinafine. But before that, I'll discuss the basics. So that you know how is the mechanism of action of every class of drug. Squalene is a molecule in the fungal cell. So this squalene gets converted to by the enzyme squalene epoxidase into squalene epoxide. Then squalene epoxide converts into lenosterol, and this lenosterol then converts into ergosterol by the enzyme 14 alpha demethylase. These two enzymes, squalene epoxidase and the second is 14 alpha demethylase. Always remember these two enzymes for antifungal therapy. They are high yield enzymes. If you know these enzymes, you can answer a lot of questions correct in your paper. So this lenosterol then converts by the enzyme 14 alpha demethylase into ergosterol. And ergosterol, which is the final component, is the part of fungal cell membrane. So, directly or indirectly, some of the antifungal drugs inhibit or affect ergosterol, which is the component of fungal cell membrane. So, they affect the structure of fungal cell membrane. Okay, so first we will start with terbinafine. Terbinafine is the class of antifungal drug that inhibits squalene epoxidase. It inhibits the enzyme squalene epoxidase. What happens when it inhibits squalene epoxidase? Squalene cannot be converted into squalene epoxide, and then squalene epoxide cannot get converted to lenosterol and then ergosterol, and then fungal cell membrane will be affected. Okay, so we'll talk about terbinafine first. So what happens? What is the mechanism of action of terbinafine? It inhibits the fungal enzyme squalene epoxidase. So squalene epoxide would not form. What are the clinical uses of terbinafine? Always remember, number one is it is used in skin infections, especially onychomycosis, which is the nail infection. Okay, fungal infection of finger or toenails. So terbinafine, always remember, clinical use is it is used in dermatophytosis, example like tinea infections caused by trichophyton, epidermophyton, or microsporum. It is also used in onychomycosis, like fungal infections of the fingernails or the toenails. It is the first line therapy for onychomycosis. Whenever in the question stem they say that the person has fungal finger or toenail fungal infection, the first line therapy would be terbinafine. Okay. Mechanism of action is very important. Clinical use is very important. What are the adverse effects? GI upset, headache, hepatotoxicity, and taste disturbance. T for terbinafine and T for taste disturbance. This is how I memorize it. So it's high yield to remember that taste disturbance is one of the common side effects of terbinafine. Like GI upset, headache, hepatotoxicity, these are common side effects you will see in a lot of drugs. But taste disturbance um, is somewhat different uh, adverse effect of terbinafine. So I would recommend to remember to memorize it, like T for terbinafine and T for taste disturbance. Now we'll talk about the second class of antifungal drugs, which is azoles. Azoles, they inhibit ergosterol synthesis. Okay, so first we will talk about look at this image again. Lenosterol gets converted to ergosterol by the enzyme 14 alpha demethylase. So all azole drugs, they inhibit 14 alpha demethylase, so they inhibit the synthesis of ergosterol. um, Now, azoles. What is the mechanism of action? They inhibit fungal sterol, ergosterol synthesis by inhibiting the cytochrome P450 enzyme that converts lenosterol to ergosterol. So they inhibit the enzyme 14 alpha demethylase, and they inhibit the conversion of lenosterol to ergosterol. Very high yield. These mechanisms of actions, I am telling you, they are going to show up in the exams. Um, Always remember the names: clotrimazole, fluconazole, isavuconazole, itraconazole, ketoconazole, miconazole, and voriconazole. What are the clinical uses? We'll talk about one by one the clinical uses of every member of azole family. So the first is, we'll talk about topical azoles. Topical azoles example, these are clotrimazole and miconazole. Remember, these are two topical azoles, clotrimazole and miconazole. They are used for superficial fungal infections, example like oral thrush, vaginal candidiasis. They are used for tinea pedis. Tinea pedis is the fungal infection of um, these are skin infections like tinea corporis, fungal infections of the body, and tinea pedis is the infection of head, fungal head infection. Okay, now systemic azoles. Systemic azoles like fluconazole. I always remember fluconazole we use for cryptococcal meningitis in HIV patients. I have seen questions in which they talk about the cryptococcal meningitis, and they ask which um, antifungal drug is which antifungal is the drug of choice for cryptococcal meningitis. So remember, in HIV patients, the drug of choice for cryptococcal meningitis is fluconazole. Fluconazole is also used for candidal infections like thrush, for esophagitis, and for UTI. Now we'll talk about the second systemic azole, which is itraconazole. Itraconazole is active against dimorphic fungus, and we have talked about dimorphic fungus already, like histoplasma, blastomyces, Sporothrix schenki. We didn't talk about Sporothrix. We'll talk about that later on. Now, the third class of systemic azole is fluconazole. We use voriconazole. We use voriconazole is the drug of choice for aspergillus, for aspergillosis. Um, so these are all high yield points. Remember, fluconazole for the cryptococcal meningitis in HIV patients. Remember, itraconazole for dimorphic fungi. Remember, voriconazole is the drug of choice for aspergillus and is also used for some candidal infections. Okay, isavuconazole is for serious invasive aspergillus infections and for mucormycosis, but it's not that important. Remember, the important ones are fluconazole for cryptococcal meningitis, voriconazole for aspergillus, which is the drug aspergillus is the drug of choice, and itraconazole for dimorphic fungus. Um, what are the side effects of these azoles? Number one is are the endocrine effects. Endocrine side effects include, they decrease testosterone synthesis. They inhibit testosterone synthesis. Whenever testosterone is inhibited, the opposite hormone, which is estrogen, unopposed um, elevated level of estrogen that lead to gynecomastia. All azoles can cause gynecomastia, but especially always remember ketoconazole. If in the question stem they talk about antifungal drugs and they ask which azole cause gynecomastia, remember ketoconazole. All can cause, but remember, always remember ketoconazole. If they give you all azoles in the option choice, pick ketoconazole. Okay. Now, the second side effect is hepatotoxicity. They can cause liver dysfunction, and they liver dysfunction because they are strong inhibitor of cytochrome P450. Azoles are the strong inhibitors of cytochrome P450. The third side effect is the cardiac side effect, which is they cause QT prolongation. These three side effects are very high yield. These adverse effects, always remember these three adverse effects related to azoles. First is gynecomastia, especially with ketoconazole. They are inhibitors of cytochrome P450, so they increase the level of drug in the blood. Um, There are a lot of cytochrome P450 inhibitors, and azoles is one of them. And third is QT interval prolongation. There are a lot of drugs that can cause QT prolongation, and azoles is one of them. So remember these three adverse effects related to azoles. Now we will talk about the third class of antifungal, which is nucleic acid synthesis inhibitor, which is flucytosine. Okay, so flucytosine, it inhibits DNA and RNA synthesis by conversion to 5-fluorouracil. So flucytosine itself converts to 5-fluorouracil by cytosine deaminase enzyme, and it inhibits the DNA and RNA synthesis of fungus. What are the clinical uses of flucytosine? One high yield point, remember, it is used for systemic fungal infections, especially it is used for cryptococcal meningitis, along with amphotericin B. I will repeat this point again with amphotericin B, but remember flucytosine, one point. If you have to remember only one point related to flucytosine, always remember that it is used for cryptococcal meningitis in combination with amphotericin B. So we will use flucytosine plus amphotericin B in patients with cryptococcal meningitis. Adverse effect is myelosuppression. So it inhibits it decreases, it causes pancytopenia. It decreases the synthesis of RBCs. Myelosuppression means it causes bone marrow suppression. So it inhibits the synthesis of RBCs, WBCs, and platelets. Now we will talk about the fourth class is the class of drugs that creates pores in the cell membrane, that is not affecting any enzyme, or that is not affecting DNA or RNA synthesis. The class of um, the class that creates pores in the cell membrane of fungus. So remember Polyenes. These are two drugs, nystatin and amphotericin B. First, we'll talk about amphotericin B, and then we'll talk nystatin. So amphotericin B, they binds to ergosterol. It is ergosterol is the component of unique is a unique component of fungal cell membrane, and they form membrane pores that allow leakage of electrolytes. Okay, so the clinical uses, they are used for serious systemic fungal infections. They are not a lot of times we don't use them for local infections. We are using for systemic fungal infections. I've already mentioned that amphotericin B, we use amphotericin B for cryptococcal meningitis along with flucytosine. If you have to remember one point, I'm repeating that again and again. Remember, we will use amphotericin B in combination with flucytosine in patients with cryptococcal meningitis. We'll use amphotericin B also for blastomyces, coccidiosis, histoplasma, and candida. They are because amphotericin B covers systemic fungal infections, so it can cover every systemic fungal infection. We have talked about blastomycosis, histoplasmosis in the previous lecture. So amphotericin B can cover all systemic fungal infections, but always remember that we are using amphotericin B also for cryptococcal meningitis along with flucytosine, and we are using amphotericin B intrathecally. That means in the CSF, we give directly into the CSF for coccidial meningitis. Um, what are the adverse effects of amphotericin B? First, it causes fever, it causes chills, it can cause hypotension, it is nephrotoxic, can cause nephrotoxicity directly or indirectly. It decreases the level of, it causes hypokalemia, hypomagnesemia. So, other side effects include erythemias, it can cause anemia, it can cause IV phlebitis. These are all side effects you should remember. And I have seen one question in the U World in which they asked about amphotericin B, that how we can manage nephrotoxicity that is related to amphotericin B, or how we can reduce the nephrotoxicity caused by amphotericin B. Hydration is the answer. We can reduce nephrotoxicity by hydration, and liposomal amphotericin B also decreases toxicity. Now let's talk about nystatin. Nystatin has the same mechanism of action as amphotericin B. It creates pores in the fungal cell membrane that allows leakage of electrolytes. But one point you should remember for nystatin is we are only using nystatin for topical use. We cannot use nystatin systemically because it is very toxic if we use it for it if we are going to use it for systemic fungal infections. So we are only using nystatin for nystatin is only for the topical use. Amphotericin B we are using for systemic fungal infections. So what are the clinical uses we are using for topical uses includes we are using for oral candidiasis like thrush, swish and swallow. We are using for diaper rash in babies. We are using for vaginal candidiasis, vaginal candidal infections. So these are the three uses of nystatin. Always remember thrush, diaper rash, and for vaginal candidiasis. Now we'll talk about antifungals that affect cell wall, that inhibit cell wall synthesis of fungal cell wall, that affect fungal cell wall. These are echinocandins, but they're not very high yield, but still we have to cover. So echinocandins, these are caspofungin, micafungin, and edulafungin. They inhibit cell wall synthesis by inhibiting the synthesis of beta glucan. What are the clinical uses? We are using for invasive aspergillosis and candida. Adverse effects are GI upset and flushing by histamine release, causing flushing by histamine release. Grisufulvin, I've seen some questions again, some questions about mechanism of action of grisufulvin. They interferes with microtubule function and disrupts mitosis and deposits in keratin-containing tissues, example nails. So we are using grisufulvin for superficial fungal infections. They inhibit the growth of dermatophytes, like tinea and ringworm. Adverse effects of grisufulvin, which I would recommend to remember, is it is cytochrome P450 inducer. So azoles are cytochrome P450 inhibitors, while grisufulvin is a cytochrome P450 inducer. Okay. Um, they can you can always remember, like there are two classes of antifungal drugs that affect cytochrome P450 system. The first is azoles that inhibit cytochrome P450, and grisufulvin they induce cytochrome P450. Other side effects are grisufulvin is teratogenic, we cannot use in pregnancy. It's carcinogenic, increase the risk of cancer, can cause confusion, headaches, disulfiram like reactions, and um, so yeah, so they are cytochrome P450 inducers, so they affect warfarin metabolism. So this is all about antifungals. This diagram is very high yield. If you guys have any questions, you can ask me in the comment section. Thank you so much.